Regurgitation or gastroesophageal reflux in the newborn, what are the differences and especially how to improve them to resolution? Regurgitation and gastroesophageal reflux of the newborn are two of the most common problems in infants only a few months old and can often be associated with irritability, crying, digestive difficulties, and gaseous colic in the newborn. Probably no one has ever told you that regurgitation and gastroesophageal reflux in the newborn baby can be prevented since pregnancy as much as possible if you understood correctly since pregnancy, or improved and treated effectively in the first months of life. This, for example, is the case with little Camilla and hundreds of my other little patients whose parents' testimonies you can find in my YouTube videos and in the hundreds of Google reviews on my Dr-Silva osteopath profile. Before I continue, therefore, let me introduce myself. My name is Dr-Silva. I am a neonatal osteopath and founder of ULE, a maternal infant center in the province of Monza and Brianza, in which I work closely with all the main figures in the health sector, such as pediatricians and midwives, visiting only newborns from their first days of life. You can find me online in this YouTube channel, to which I highly recommend you subscribe now to stay updated on all new videos, on Instagram under the name Osteopath Silva Matteo, and especially on my website matteosilvaosteopata.com, where you will find hundreds of courses and informative content to promote your baby's best development, treat flathead and plagiocephaly, treat colic and gastroesophageal reflux, and so much more. Now let's cut the nonsense and get to the heart of this video. Vomiting, regurgitation, and gastroesophageal reflux. What are the differences? The terms vomiting, regurgitation, and reflux are commonplace in the neonatal setting. However, there is a need for clarity on the difference between these terms, which sometimes can be subtle and almost unnecessary. Above all, there is a need to really help babies who suffer from these issues without saying that it will go away on its own by the time they are 1 year old. In general, regurgitations are defined as the mild to moderate episodes in which the child vomits milk so it comes out of the mouth. Usually these episodes are more likely to occur close to feeding. Usually, despite the regurgitations, the baby grows regularly. In any case, the baby with regurgitation may be more or less bothered because of then gastrointestinal disturbances. The term vomiting is often used to refer to episodes of moderately severe regurgitation. Episodes in which the child may vomit, perhaps even projectile vomiting, large amounts of milk. In cases of vomiting, but also regurgitation, it is always important to make sure that the child is growing and does not have more serious problems, such as pyloric stenosis, blood in the milk, vomiting, and so on. So always consult your pediatrician. When your child has major vomiting episodes, you should contact your pediatrician to rule out pathological disorders. Instead, the term physiologic gastroesophageal reflux of the newborn baby is often used to refer to a digestive difficulty of the infant that occurs immediately after a meal or remotely, with irritability and gastrointestinal difficulties, perhaps even hiccups or even regurgitation or vomiting. Assuming that the infant should not be bothered when eating and when regurgitating, the term physiological simply indicates that the child, in spite of everything, is fortunately growing and does not have more serious pathological problems. However, I do not like to call reflux physiological, especially if the child is in pain. All gastrointestinal problems of the newborn baby can easily be improved to perhaps being resolved completely. In the video course Prevention and Treatment of Gas Colic and Gastroesophageal Reflux, which is on my website matteosilvaosteopata.com and which I link below in description, I explain how to do this. Now, however, I want to anticipate the real causes why the stomach and intestines start to get a little bit irritated, and then you can create regurgitation and then reflux. As we understood in the chapter, so in the paragraphs we talked about earlier, the terms regurgitation and gastroesophageal reflux are very similar and often subsume the same thing. Gastric digestive difficulties, with possible regurgitation, irritability and discomfort. When the infant suffers from reflux but does not regurgitate, it is called silent reflux. subsuming digestive difficulties and discomfort in the absence of actual milk regurgitation episodes. The main cause of infant regurgitation, which you are used to but spoiler is false, is the infamous immaturity of the cardia, i.e., that valve that closes the stomach superiorly and should not allow milk to rise into the esophagus and then into the mouth. In other words, it is often said that nothing can be done to solve the baby's regurgitation and discomfort because it will improve on its own over time. But is this really the case? Is this really the only cause of regurgitation and reflux? The answer is no. In fact, far from it. The causes by which the baby's stomach becomes irritated then causes regurgitation, reflux gas, esophageal gas, hiccups, and digestive difficulties are quite different. Just as gas colic is caused by an inflammatory bowel framework, and see the scientific study that proves this and which I link to in description, reflux is also caused by an irritative state of the stomach, and that is why the infant is not only regurgitated but often cries from discomfort, both during feeding and after it. The causes, and consequently also the remedies, of reflux are very similar to those of colic, partly because the milk first transits from the stomach and then passes into the intestines. Only by knowing the true causes can we then take action to resolve or improve reflux. Otherwise, we continue to use drug therapies to try to buffer the symptoms, but without then assessing the origin, thus the true causes of this problem. The causes of regurgitation and refluxed esophageal gas can be found, for example, in the type of maternal feeding during pregnancy, in lactation, in the maternal microbiota, in palpable gastrointestinal strains that can be improved, e.g. by massage, in supplements, in the type of formula, if any, in the bottle, in the teeth, and many other parameters that I have explored in detail in the video course Cure and Prevention of Infant Gas Colic and Rhesus Gas Reflux, which you can of course find on my website matteosilvaosteopata.com. With these last sentences, this video has come to an end. It has been my pleasure to create this informative content for you, and I sincerely hope that it can be of great help to you and your beautiful baby. If you liked the video, I kindly ask you to leave a like. It costs you nothing, but it is worth a lot to me. To subscribe to my YouTube channel, follow me on my Instagram profile, osteopath-Silva Matteo, and to visit me on the website. See you in the next video.